There are people on both sides, and I think there are different levels that people have to take. And for us to recognize this as the person who's going to go ahead and influence what someone's going to do with their life, or maybe a child can sleep a little bit further from a room, I think we have to be careful when it comes to public policy and public safety, how we're representing ourselves. So that's fine, but you keep bringing up the World Health Organization constantly. I've been here for 2 meetings. It's the World Health Organization, the World Health Organization, the World Health Organization. You tell us that these things are known, and they've done studies for 20 years, and they've done everything. Why not go to their website? Childhood leukemia is a comparatively rare disease with a total annual number of new cases estimated to be 49,000 worldwide in 2000. Average magnetic field exposures above 0.3 microtesla in homes are rare. It is estimated that only between 1% and 4% of children live in such conditions. If the association between magnetic fields and childhood leukemia is casual, the number of cases worldwide that might be attributable to magnetic field exposure is estimated to range from 100 to 2,400 cases per year. Based on the values for the year 2000, representing 0.2 to 4.95% of the total incidence for that year. Thus, if ELF magnetic fields actually do increase the risk of the disease, when considered in a global context, the impact on public health of ELF EMF exposure will be limited. So my first question is, for the 345 line, are we potentially going to be exposed above that 0.3 microtesla, where it says only 1% to 4% of children in the entire world are exposed? And number 2, after hearing that, if, can you sit there and after talking about the World Health Organization, say that there's actual studies that show that this does not cause childhood leukemia?
Well, number one, I guess it's difficult to respond to things that are being read off a cell phone and so forth. But yes, I mean, the World Health Organization has looked at it. They wrote a long and extensive report in 2007. And if you look at the whole report, the bottom line was that they said, yes, there are epidemiologic associations, but they are not supported by biological evidence, by evidence in animal studies, by laboratory evidence, and so forth. And their bottom line conclusion was that they feel that there is not sufficient evidence to really establish standards, and that doing standards at extremely low levels is not going to be supportive of public health. And so I think all I can say is that, look beyond the World Health Organization as well. Look at the American Cancer Society, look at the National Academy of Sciences, look at the Centers for Disease Control, look at the National Institute of Environmental Health Sciences. I mean, they're the ones who are actually funded.
Can you answer either of my questions? Are children going to be exposed to greater than 0.3 microtesla, which they say only between 1% and 4% of the entire world's children get exposed? And number 2, can you say conclusively that they would agree that this can potentially cause childhood leukemia?
Well, I would have to look at what verbiage they use. I mean, I'm just assuming that you read it correctly, and that there are epidemiological studies that might suggest that there is such an association, but that association is not necessarily causal, and I think they feel that evidence is quite strong that it is not causal.
Okay, so you're saying that there is a chance, number 1, and number 2, are kids going to be exposed to greater than the 0.3 microtesla?
Well, you mentioned that you lived at 498. I looked at that corner. I think this was in response to a question that came up at the last time, and I think the field there is approximately 1 to 2 milligauss, which is something like 1/10 or 2/10 of a microtesla. So it's below the.
So you don't think there's a chance that we're going to be exposed to more than 0.3 anywhere on that line?
Well,
could I ask Eversource that question?
I was just giving you the result for that location.
Any location. I'm not just concerned with myself. Unlike you people, I actually care about the rest of my community. Will it be exposed? Will our children be exposed to more than 0.3?
Well, you have the results for directly over the line. Directly over the line, it's probably 3 microtesla.
3 microtesla?
Yes.
That's 10 times greater than what the World Health Organization is saying in this, when they're talking about childhood leukemia, where only between 1 and 4% of all children.
Numerically,
yeah.
correct.
just ask you to provide a citation to the Board of Selectmen so that we can research this?
It's the who.org.
Just provide it to the chair of the board so we can research it.
I guess the question was, could you send the text that you were citing, to send a reference?
Yeah, that's no problem. It's on there.
Okay.